Hi everyone, this is my safety video. I'm going to be discussing a training seminar that I went to at the hospital called Nonviolent Intervention. This is a safety protocol part of the hospital. This program was put into place about 10-15 years ago to help minimize workplace violence issues that happen with patients that come into our care. Particular training shows staff members how to get out of certain situations or how to handle difficult situations. There are two levels of training for this. There's a lower risk and a higher risk. Lower level training is for mainly a lot of administrative personnel, dining services, those who don't have a lot of direct patient contact. The higher risk is for direct patient contact staff members such as nursing, physicians, rehab, OT, any other therapies that need to be done, as well as case managers and social workers. Part of the training seminar was lecture, part of it was physical. The physical portion showed staff members how to handle themselves in situations if a patient was able to get their hands on them. Shows them certain maneuvers as to how to get out of these particular situations without harming the patient, I don't want to say as much, but causing any unnecessary physical harm if need be. But it also shows the staff member how to get out of these situations without being hurt themselves. The lecture portion discussed how an individual going into a room that has a violent, aggressive patient in there, on how to talk to that patient, how to use their voice, because tone of voice can help de-escalate a situation before it gets any worse, as well as certain words that were being used. There were techniques that were shown on how to stand in a room without looking menacing or authoritative, but letting the patient know that you're there for them, that you're there to help them. That oftentimes helps to de-escalate a situation as well. There are safety protocols that are used within the hospital called a code gray. That particular protocol is used if you have a violent or aggressive behavior and the direct patient staff member cannot control the situation. This usually involves the hospital security being involved, as well as paramedics from the emergency room coming up to help diffuse the situation. Oftentimes that patient ends up having medicinal help to help them calm down, and sometimes they're put in restraints as well. We were shown how to use restraints. Using restraints from the social worker perspective is not ever going to happen, but they want to show that. So if a social worker or a case manager walks into the room, they can understand the meaning for the restraint, the type of restraint that they have, and what they're used for, because there are many different types of restraints out there that are used for patients. Depending on if they're on the geropsych floor, they will use a pelvic restraint, and that keeps them sitting in a chair. There are 4-point restraints that are sometimes leather or cloth. Those were often called, the cloth ones are often called soft restraints, and then the 4-point leathers are usually if you have a patient that is a very violent, aggressive patient. There's also the police protocol that is put into play that is not often used very much, but it is there if the code gray does not work and the situation cannot be diffused. The staff members reserve the right to call the police in to help with the situation. This training is very, very beneficial to have, because not only does it show you certain techniques as to how to get out of a compromising situation, but it shows you how to walk into a room and address the situation ahead of time. Because if you know you're going into a room with a patient, you know that you're going to need to speak in a calm, concise manner and in a way that the patient is going to understand you. The other technique that is utilized within the hospital in regards to dealing with a patient who has violent or aggressive behavior is making sure that you don't go into that room by yourself, and that if you do go into the room with another individual, that you are both positioning yourself in the room in such a way that you have easy access to the door. You don't want to be pinned between a wall and a bed or a chair where the patient can get at you if the situation does not seem to diffuse itself. This training is very, very important, I feel, for both nursing staff as well as social workers and care managers. Everybody needs to be able to understand how to deal with a situation with a patient that is violent or aggressive. And in this particular area that I live in, unfortunately, we have a high population of drug abusers that come in and are aggressive because they're on a high at the moment, or psychiatric patients that just, don't understand what's going on and are scared. And using the way that you speak and how you address a patient often it helps quite a bit. So I got a lot out of this class from a social work perspective instead of a nursing perspective, because I've taken it from a nursing perspective. So it was very interesting for me to go into it with a new look, and now I'm very aware of when I go into a patient's room, and I'm more so aware of how I talk to a patient, whether that patient is violent or aggressive or not, because it's amazing to see how they respond to you. So my question to you would be, how would you handle a compromising situation with an individual that has tried to attack you? What methods would you use, or have you ever had any training in regards to that? I think that it's very important that anybody working in a human services field knows how to, if you're having direct contact with individuals, how to de-escalate a situation. So I'm just curious as to find out what other methods people have used, or if you've been in a situation such as that. So thank you very much.